Speaking about inspirational, I just, some of the other things that we do or we have in Bucks County is a robust crisis. And I have Chris Thompson, who I am proud to work on the task force with. He is my co-chair, and he's going to tell us a little bit about the crisis services in Bucks County, because he not only is a co-chair for the task force, but he also is the director or associate executive director of Lenape Valley Foundation Crisis Service. We also, on the call, we're going to be talking to John Turner. I do want Chris to talk most about them, but maybe one thing that Deb and I can talk a little bit about is crisis intervention.
Right.
Our crisis intervention team. I think it's really important as our goal for the next segment is to talk about first responders, to talk about our crisis services, and that's something that John's going to bring to the table, is talk a little bit more about first responders. But our crisis intervention team, I would like Deb to kind of start out, but it is a training that we offer to our law enforcement.
Well, the CIT task force came out of one of our classes called NAMI Family to Family, and this is a 8-week class where we teach families how to what a mental illness is, how it's diagnosed, how is it treated, and how can they support their loved one who may be experiencing a mental health issue. And one of the things that the people in the class decided that was a really big problem here in Bucks County and actually everywhere was that a lot of people were finding themselves getting into trouble with the law and getting involved in the criminal justice system, and were ending up in jail rather than being in treatment for mental health. So they decided that they were going to look around the country and see what kind of programs were already out there. And one of the ones that they settled on was a Memphis model, and it's called CIT, which stand for Crisis Intervention Training. So in 2008, the task force was formed, and that included some of our base service units, the Bucks County Department of Mental Health and Mental Retardation at that time is what it was called. And in 2009, the first CIT class started. So now this took a long time. It was several years that they had to advocate and try to get this program off the ground.
CIT is a 40-hour class that is offered to law enforcement, and maybe we can get into a little more detail after we get the opportunity to talk to Chris. But Chris, if you can you hear us now, Chris?
Yes, I think we've moved past the technical difficulty.
Hey!
Great. You guys are doing a great job up there. Thank you for your service tonight.
Well, Chris, tell us a little bit about Lenape and the crisis services in Bucks County.
Sure. My name's Chris Thompson. As they said, I'm the Associate Executive Director of Crisis Services at Lenape Valley Foundation. I'm also a certified QPR trainer. Been doing QPR before it was even cool. And I love to provide QPR to the community. But at Lenape Valley Foundation, we provide the vast majority of crisis services in Bucks County. And I'm just going to run through the list of services we have and then talk about each one briefly. We have the crisis residential program called The Lodge. We opened that in September of 2019. We also have site-based walk-in crisis at Doylestown Hospital and at the campus of Lower Bucks Hospital. We also have mobile crisis services providing service to the entire county. We have a 24-hour crisis hotline that you can call anytime, 365, and talk to a crisis worker. We also have a warm line that is operational during the week, during daytime hours, and that is answered by a certified peer specialist. And then last but not least, we have our first responder support line. And we have John that will be talking with us tonight about that a little bit further. Just real quick, the crisis residential program is an alternative to inpatient psychiatric services. It's a great environment. It's home-like. It's less traumatizing. You're allowed to keep your shoes and your laces, and you're allowed to keep your cell phone. And we try really hard to create an environment that's client-centered, and where we're thinking a lot about unconditional positive regard for the individual we're working with. We provide individual therapy, group therapy. We have certified peer specialists embedded in the program. We work really hard on discharge planning and aftercare planning. So it's a great little program. It's been a little challenging to open a crisis residential and have a pandemic hit. That's been a little interesting, but we've certainly worked through it, and we're still providing service and have people coming in and avoiding inpatient psychiatric services, which is really important for many folks. We also have walk-in crisis. If you were to walk into one of our crisis centers, you'll meet with a crisis worker who will conduct a level of care assessment, provide you with crisis counseling, and then work really hard to connect you with services that are appropriate for the experience that you're having at the time. Again, crisis workers work really hard to meet the client exactly where they are and provide that unconditional positive regard throughout the experience. We also have mobile crisis services. And real quick, I'm going to give you a number for that. 1-877-435-7709. You can call that number anytime, 24/7, 365, and make a referral to our mobile crisis team. At the same time, you'll be in contact with a crisis worker that can help you work through any immediate challenges you're having in the moment. We provide service to the entire county. We provide service to adults and children, which is a really good aspect of the mobile crisis team. A lot of times, families experience crisis together, and multiple people are being infected by that. So mobile can come out to the home and interact with the family and help de-escalate the situation, and then provide referrals to outside providers. So please, if you need help, reach out. There's multiple ways to do that. The 24-hour hotline number is 1-800-499-7455. Write that number down, put it in your wallet, put it in your purse or your back pocket. Call anytime. And that is for any kind of crisis that an individual or a family is having. We also have a warm line, and as you can see on the screen, the phone number for that is 215-896-9717. And that is available Monday through Friday from 1 to 5 p.m. And again, it's answered by a certified peer specialist. Now, the warm line is for more of like check-in, see how you're doing, give an update, touch base with a peer support. And it's someone that you can build a relationship with over time and call here and there when you just need to talk to somebody. And then now we're going to move in and talk a little bit more about our first responder support line. And I believe John is going to join us. He is a volunteer and a coordinator and helps us provide that service to the community. He's actually someone who answers that line if you call.
Yeah, hi. How is everyone this beautiful day?
Hi, John. Thank you. Thank you for joining us. John, tell us, what is the first responder support team?
Okay, we are a specially trained peer support. Everybody that answers the call is either a retired or presently working as a first responder, either police, fire, EMS, dispatcher, and we're here to be able to help anybody that is having any type of problem. If you're having a problem with work situations, a bad call, if you're having a problem with your spouse, we're here to be able to have you call us, and we have big ears, is what I'd say. We have real big ears to be able to listen to you and see if we can work out the situation a little bit with you and hopefully get you in a better place.
So this is a peer support line that is for first responders, right?
Yes, just for first responders.
Okay. And during the pandemic, did I hear correctly that this line is opened up to healthcare professionals as well?
Yes, all the frontline workers, it opened up to them, and it's actually done pretty well with that. We've gotten a handful of calls because of that. They see just as much as the first responders do and see more death and more problems at times.
Well, there's a partnership there, right? I feel like the frontline workers, having worked in the healthcare field, I think that the partnership with first responders and healthcare professionals, yes, is one and the same sometimes, right?
Yeah, we work all hand in hand.
John, is this for the Bucks County residents only?
That's what it started out as, but we've actually have expanded out to Allegheny County. We've had people calling us from other states also, Virginia, Washington, all over the place. So it's mainly for Bucks County first responders, but we will take calls from anybody and help anybody out there, because what we're finding out is there's different states that don't have the system set up like we have here in Bucks County. We're very lucky to have all the crisis intervention people that we do. Especially down in Virginia, we've received a few calls from down there because there's just nobody to call for first responders.
That's great. So you're saying if, you call from Montgomery County or Virginia, you're not going to turn them away?
Never we'll never let anybody and turn anyone away. Never.
Now, what about family members of first responders? Is this something that they could utilize?
Yes, they can. That's one thing that we've been trying to work on and getting the word out, that it's not just for the first responders, because the family members of first responders see and sometimes feel what's going on with whoever is actually responding to these calls. They come home, they flip out, they have problems. So we've opened it up to everybody, the whole family, to be able to have them come in and talk to us.
So I'm seeing here, what is the number for this line?
Okay, it's 267-893-5400. That is for what happens is you call that number. It actually goes to the crisis center in either Doylestown or Lower Bucks, and all they have to do is that they want to talk to a first responder, or that they are a first responder, and what they do is crisis will forward it to one of the on-call members that uses cell phones to be able to talk to them. We've had people call up and just say, "Hey, I'm having a problem," and they have. We've talked to people for 5 minutes, and we've talked to people for 2.5 hours, just to try to help them through whatever problem they're having.
Is this number available 24 hours a day?
24/7. We're always there, ready to help out.
What if you get a first responder that is calling and in some kind of crisis, like having thoughts that they want to die by suicide? Is this the right number to call if they're feeling that way?
We would prefer them to call 911, but if they do call us, we will help them and most likely call 911 for them, but we will help them through whatever problems they're having. Because we do not go out to the call, we are just strictly on the phones, but we will get them help as soon as possible.
John, if somebody's already seeing a therapist or a professional, can they still call you first?
Sure can. We've actually had many calls that way where they're actually seeing therapists on a regular basis, and for some reason they can't get to them, especially during this pandemic. They're having a tough time getting to the therapist, so they call us, and like I said, we'll listen to anything they have, any problems they have, and we try working with them. If they don't have a therapist, we actually have resources throughout inter-county and out-of-county where we can refer them to the people, either in treatment, out treatment, to be able to help them out.
That's great. And one thing I learned is that when you were looking for resources, you truly vetted these out to know that these are professional resources that work well with first responders. Isn't that correct?
Yes. Everybody that we've talked to is either a first responder, has worked with first responders for many years, and they're willing to work with them, bring them in, and they have some idea what the problems are that they're going through, or may have been actually in that problem before. May have had that rough call a death that they've seen, or any other problems they've had.
So, John, if people wanted more information about this, who or how do they go about getting more information? What if a first responder wanted to bring this to, if they're a firehouse or something like that? What do they do? How do they go about getting information?
Okay. They can call that hotline, and they will get in touch most likely with me or Nicole Wolf, and we will get them either a flyer, business cards, or we will come out to their station, to their headquarters, and actually give a talk about it and let them know firsthand what's going on. We do everything we can to work with them, to be able to get it out. We really do.
Is there anything that First would need to help with this cause? Anything that you need?
One of the best things would be donations. We don't actively ask for donations, but just be able to help with the cell phones and some of the advertising costs that we have. We are all volunteer, and it is all confidential. But we just need the some donations, and you can send them to Lenape Valley Foundation, and then make sure you put down First Responder Support Team, and that way we will receive it. We also may need some more call takers soon. So if anyone is retired that is a first responder or was your first responder, please get in touch with us, and we'll see if we can get you the training and get you on board. And we need more people to talk about it, get the people out there and make sure people are aware of it. Finding out a lot of first responders, even though we have flyers and we've talked to numerous people, they don't know about this. And what some people are thinking, because I've talked to some and they go, well, it's only for work-related problems. Well, it's not. It's for anybody, either a personal problem, work-related problem. It could be a spousal problem. It could be one of your kids got you mad and you just need to vent. So you can just call us up and just scream at us if you want, and just let us know, hey, we're having a problem, and vent it out. People just need to talk.
Well, thank you so much, John. I mean, one thing that we know is first responders like to talk to first responders, right? Especially, they have an understanding of what they're doing. So I appreciate so much of what you do for this county and for this line. One thing I learned about John is he is a first responder in almost everything. He's a retired police officer, firefighter. He has been such an asset to our community. So thank you so much. And he continues to keep giving to the community. So once again, I am just so privileged to work in Bucks County with such wonderful people. Thank you.
Thank you.
Thank you, and thank you for the opportunity to talk online here and let people try to hopefully let more people know about us.
Yes, we'll
And
get
thank
the
you
word
for your
out. Thank you, John.
Thank you.
Thanks,
Bye bye now.